Hello, everyone. Welcome to Prevention, Progress, and Wellbeing. Today, we're here to talk about a topic that I think most of us know is important, but one that often gets pushed to the bottom of the priority list, and that is preventive care. Whether it's scheduling an annual physical, completing a recommended screening, or establishing a relationship with a PCP, many people delay preventive care because, I don't know, I guess life gets busy and things get in the way. Yet those small decisions can have a significant impact on outcomes, healthcare costs, and overall well-being. And as an employer, we know that healthcare costs continue to rise and be concerning. And you're also facing pressures to deliver value through your health benefit, as well as your well-being strategies with probably limited investment. This is the reality right now. And so today, our goal is to help you think a little differently about prevention, not as a standalone program or as an annual campaign, but as a foundational element of a comprehensive well-being strategy. My name is Christine Muldoon. I'm Senior Vice President of Marketing and Strategy here at WebMD Health Services. And joining me today, my partner in crime, is Erin Severson, Senior Director of the Center for Research. Now, before we dive in, I'd like to start with a simple question. And you could go ahead and put the answer in our attendee chat. And so the question is, have you personally ever postponed a preventive appointment, screening, or checkup, even though you know that you should have scheduled it? And I will say, first and foremost, this is a judgment-free zone, so go ahead and be honest. And just let us know. Maybe you want to do a thumbs up, maybe it's a yes, no, whatever works for you. Go ahead and put that in the attendee chat. Okay, I'm not seeing, oh, there we go. Okay, great. Yes, yes. I know I have. Erin, I don't know about you.
Yes, admittedly
Okay.
so.
All right, not this gal. Well, we're proud of that person. Actually, ironically, I did just schedule my well-being visit and had that on Monday. So all fun stuff. But we have a little bit of a mix. It looks like maybe a few more of you are saying yes versus no. But what I do want to say is that you're not alone if you said yes, because more than 90% of Americans have put off getting a checkup or a recommended health screening on time. Now that, yeah, you need to find a new doctor, that's also a challenge. We're going to talk about barriers too. So for those of you that did say yes, I just want you to think about maybe why you put off that health screening. And again, maybe it is because you haven't found that doctor. But what we are also seeing is that for most employees, they're not avoiding preventive care because they don't value it. They put it off because of some common barriers that we're seeing. Fear, like they don't want to go to the doctor. They don't like to go to the doctors. It's also about time, getting time off from work or just other responsibilities that they have. Anxiety about what they might uncover from that preventive care or that screening. The cost of service, whether it is the cost of actual preventive care or the future cost, again, based on what they might find. So if this is true for you, all of us, then we also need to consider these same barriers for your employees and members as well. And think about those as you build out your preventive care programs.
Yeah, that's a remarkable statistic, isn't it, Christine? 90% putting off preventive exams, which is fairly well reflected amongst our attendees today. But I also find it really interesting that nearly 60% of individuals completely avoid preventive care, just avoid it altogether. And this avoidance, whether it's intentional or not, does have a lot of important downstream implications for employers, as you were alluding to. We see it reflected in healthcare costs with higher cost of care to treat and to manage more advanced disease states that really could have been mitigated with earlier detection or earlier intervention. We also see it reflected in our workforce. Individuals who are showing up at work who are not well contribute to greater absenteeism, time away from work. In fact, 75% of individuals with chronic conditions need to take time out of their workday to manage those conditions. And the majority of those individuals say that they haven't yet talked to their employer about their situation. So you can see how that might present some disruption just in terms of general business operations. There's an impact to productivity, impact to presenteeism. So as we put this quite simply, a focus on prevention represents an opportunity for us as employers to not only improve the health outcomes for our employees, but also enabling a well and productive, resilient workforce. And in fact, research that we conducted and published out just earlier this month by the Center for Research within WebMD Health Services shows that individuals who feel good about their health and about their well-being show up differently at work. They're more engaged, they perform better, they're less prone to burnout, and they're more likely to stay with their organizations. So focus here on prevention and well-being is a really important lever for you. Focusing on prevention needs to become that strategic priority for both your people and for your business.
Okay, so we'll do a little switching gears here. We've been talking about very right up front, employees are putting off preventive care and the reasons. But now we're going to think about the impact of putting off that preventive care on your organization. So another question for you, and again, respond using the chat. What health conditions are driving the greatest costs for your organization? You can list one, you can list the top 3, the top 5, whatever it may be. We want to understand the conditions driving the greatest costs for your organizations. And again, just use that chat function. And as you all are filling that in, I'll share just some data from different consultants and industry groups like Business Group on Health. And I think we're seeing some of the similar ones for you all. They cite cancer, musculoskeletal, and cardiovascular as the top 3 conditions driving the greatest costs. And I'm seeing some very similar responses as well.
Mm-hmm.
You know, so it tends to be these top 3, maybe some other GLP-1s is another, great example driving costs, and something that we're focusing on obviously as employers. And if you think about the ones that you have listed, the greatest cost for your organization, the conditions, think about how prevention might play a role in decreasing the costs for those conditions. We know that prevention is a strategy that can lower the increasing costs of conditions like the ones you all have listed: cancer, cardiovascular disease, MSK, even diabetes and prescriptions. But looking at this holistically, we need to think about lifestyle interventions, early screenings, and other types of medical therapies for these conditions that actually can identify early and even stop the progression into some of these more expensive acute stages. And many of the high cost conditions that you all have noted actually do, I think, Erin, share something in common, which is that some of them really do have opportunities for early intervention.
Christine, I think this is where a lot of organizations sometimes miss the mark. They focus very heavily on managing conditions rather than preventing them in the first place, right? So I just want to take a minute and think about what we mean by prevention. When we talk about it, we have to look at it holistically. True prevention is multidimensional, and it spans 3 critical areas. First, it's about preventing disease before it occurs, which I think is how we often think about prevention. Screening and early detection, again, feels like a very natural conversation when it comes to prevention, but also treating and managing existing disease. So there's three main prongs. And this framework forces us to look both upstream and downstream from any diagnosis. It shifts our mindset from simply managing a condition to actively reducing risk, and it can move us from a focus or a culture on treatment to one that is much more grounded and centered in health and in well-being. And to be really clear, this is not about deprioritizing disease management. That remains a very necessary pillar of your holistic strategy. It's simply about broadening our scope to capture the full spectrum of preventive care. So let's take a look at some data to build our case out a little bit. Here's what we know. Research supports 6 core lifestyle behaviors. I bet we could name them. Throw them in the chat if you know them, but I'll say them out loud. We can chant together, right? Poor nutrition, physical inactivity, tobacco use, excessive alcohol consumption, insufficient sleep, and unmanaged stress. Those 6 lifestyle behaviors are primary drivers of 15 different chronic conditions that are responsible for 80 to 90% of healthcare expenditures. Said another way, 90% of our nation's $4.9 trillion in annual healthcare expenditures are for people who are dealing with chronic conditions, who are dealing with mental health conditions. In fact, 75% of US adults today are dealing with a chronic condition. So as you think about your network, these are your friends, these are your family, these are your neighbors. And what's more is that the majority of these individuals are dealing with more than one. So the whole story, the conversation is very complicated, it's very nuanced. And one statistic that I find quite striking is that 80% of this chronic disease burden could be prevented through lifestyle choices. So a strategic focus on prevention and on early identification, early intervention can have a significant impact both on the prevalence of disease, how that shows up within your organization, but also on cost. So how do we shift from the reactive approach, where it's a little too late, a little too downstream, to one that's more proactive, more of a prevention approach? And this really is well-being at the very core. It's about taking a holistic approach to prevention and to health management, considering the whole person and how their needs are evolving over time. Because if we focus only on supporting people who are already struggling, we don't have a well-being strategy. We don't have a prevention strategy. We have a recovery strategy. It's much more of a block and tackle. And is that really the position that we want to take when it comes to how we support and how we show support to our employees and our members? Of course not. Of course it's not. So what we're really talking about here is taking an eyes wide open approach to best meet people where they are and across the entire continuum of need. Our goal, when we're thinking about our strategies, is to deploy programs and opportunities to really deliver the right level of support to the right person at the right time. And that means that we are actively working to keep the healthy people healthy by reinforcing positive lifestyle behaviors. We want to create opportunities to identify and to reduce health risks for those who need it. We want to empower employees with guidance and with resources so that they can make informed, important, smart healthcare decisions. And we want to create those opportunities where we can identify disease early on, we can catch it, so we can provide intervention, we can provide support for those individuals who need help in managing those conditions well in order to mitigate and avoid complications over time. And undergirding all of this, of course, is ensuring that we're providing quality care regardless of where people fall along the spectrum to ultimately optimize outcomes and drive towards a positive quality of life. So when you look at it through this lens, prevention isn't a single initiative. It cannot be a single initiative. It has to be a multidimensional strategy. This is really prevention in action. And this is exactly how we think about well-being, very much so multidimensional.
I love that, Erin. I think for me, seeing that visual helps really think about how prevention is well-being. So based on what Erin just shared, just curious how many of you actually focus on prevention along that same entire continuum? Or do you focus on maybe, keeping the healthy and focusing on services there? So go ahead and put that in the chat, thumbs up, or, we do the whole continuum, or we focus on maybe healthy, those that are at risk, high risk, just to kind of remind you what was on that continuum. And then there's also early disease, and then those that, have a chronic condition, and helping them really manage that condition. And it's okay. I mean, sometimes we don't think about the full continuum, and preventive strategies tend to be more on either one end or the other end. Broad spectrum wellness, great. Biometric event every year. That is great to identify those healthy, but those also at risk, or, and we'll share some examples. Love to see a lot of you doing thumbs up. Yes, Christina, we'll talk about preventive care and the struggle with engagement, and hopefully share some ideas, and glad to see, some talking about incentives. So preventive care is probably one of the most effective ways to address some of these health risks before they become more serious and costly. But as one of you just mentioned, engagement in preventive care is hard, and it can't happen in isolation. So we know that it's influenced by multiple interconnected dimensions of well-being. So it's really important to think about taking a whole person approach that helps us look beyond just the individual health interventions, identify missed opportunities, and really better understand the broader factors that are shaping health behaviors. And when we do that, we're better positioned to improve preventive care engagement and drive better outcomes for both the individuals within your organization and your organization overall. So if I can put it more simply, prevention can't be a separate program. It actually is the foundation that connects all the things that might be impacting someone's health, how they show up to work, and thinking about all those dimensions of well-being at the same time. So what I want to do is walk you through 3 real participant stories that bring this concept to life. I will say that these aren't simply stories or testimonials about preventive care alone. These are stories about real life. They show how things like financial pressures or emotional well-being, social support, and just the everyday realities and how they influence our ability to prioritize our health. And so that's why we firmly believe at WebMD Health Services, prevention requires a whole person approach, not just a focus on any single dimension of well-being. So the first real testimonial I'm going to share with you is, this is one of your employees. So just think about this. This is actually Matt. He's a field worker, and he has a labor-intensive job. And the things about Matt that might become more obvious when you look at some of the data is that, okay, Matt hasn't had a preventive screening in years. And on top of it, he has diabetes. And some of you said that was one of your top costs, but he also is not managing his diabetes either. So those are 2 health things that probably stand out about Matt. But the other thing that we have to think about is Matt's work environment. So the barrier is reaching Matt and Matt getting access and time from work to get care. And so if you have employees that are out in the field, it probably sounds pretty obvious, but you have to reach them differently and you have to recognize that they're not in the office and at a desktop. So obviously mobile is really important for someone like Matt. The bubbles around Matt are all the things that are impacting his health and things that we may not really know about, like connection or loneliness. And I know some of you talked about mental health as one of your big cost factors. So we need to help Matt prioritize his health, prioritize his health care, and prioritize his preventive care. And we have to address some of the barriers for Matt. In this case, another is accountability. He needs accountability. He's not keeping his diabetes properly managed. And so how can we support Matt? And referring back to Erin's continuum, Matt is really, I would say, at the far right in terms of he has a disease that we need to help manage, but also somewhere within that continuum, he's not even getting his preventive care. So we need to focus on that. So I'm going to play a quick testimonial so you can hear a little bit more about Matt and how you can incorporate how you reach out to Matt, but also embed those health goals to remind Matt about getting preventive care as well.
I think one of the main things that I would have to say positively about the program is that every month checking in with somebody on your progress, or maybe if you failed a little bit, just that knowing you've got that monthly person that you are going to talk with kind of keeps me on track. It helps motivate me to actually follow through.
So in this story, it isn't just about preventive care. It's about recognizing his challenges, work environment. He's delaying his care, and he's in a situation where his health condition becomes more serious and disruptive, and having someone to help support that accountability, provide those reminders, leveraging the platform where he gets that information and combining the condition management alongside the preventive care. I'm going to transition to our second testimonial.
My name is Corby White. Back in 2021, when the pandemic was at its peak, I went into the doctor's office to get my physical and biometric screening. My primary care physician comes in and she looks at me and she goes, "Corby, are you feeling okay?" And I said, "Yeah, I'm fine. What's going on?" She said, "I'm about 2 seconds from admitting you to the hospital." She said, "Corby, your blood pressure is 185 over 110. And she said, "Corby, I want you to write down everything you eat during the course of a week." So I sat there, I wrote it down, and I gave it back to her. And she looked at me with her jaw to the floor. She said, "I want you to go home, throw all of this stuff away, and go meet with this nutritionist." She looked at me, she said, "You're eating processed foods 3 to 4 times a day, every day. That's what's going on." So I met with the nutritionist, went home, threw the food away, spent a lot of money on the organic and good stuff, and my blood pressure went down a little bit, but it didn't go back to normal until I met with my coach, Sarah from WebMD. She asked me what time every day do I go to the gym. I told her 4:30 in the morning every morning. She said, "Okay, what time are you going to bed?" I said, "Somewhere between 11:30 and midnight." She yelled at me through the phone. She said, "There is no way your body is recovering from a full day's work and a workout with only 3 to 4 hours of sleep." So we took a look at the calendar and we set goals for each week. Within 2 months, I was up to 7 hours of sleep each night, and my blood pressure went down to normal. And so literally, Sarah saved my life, because as my primary care physician told me, that high blood pressure, pre-hypertension and hypertension Those are the silent killers, especially as a Black man. That was back in spring of 2021 that all of this took place. The biometric screening, the nutritionist, me starting the coaching with WebMD. So now my health is really good. I'm in a good place. I can tell when I'm not getting enough sleep. When I don't get enough sleep, my blood pressure goes up. When I get enough sleep, it's back to normal. There's a direct correlation between sleep and my blood pressure, and I wouldn't have known that without WebMD.
So I should have prefaced this with that video is not meant to be a sales pitch. It really does truly, if you focus on his story, it fits the problem that I think many organizations are trying to solve for. And in his story, preventive care started with the biometric screening and created an opportunity, truthfully, as we saw with his blood pressure, for early intervention and a better outcome. The first story was also a real testimonial, again, articulating the importance of supporting the whole person. And both of these are examples of really why well-being and prevention are inseparable. It's not just about helping people when they're struggling. It's about creating an environment where our healthy choices are easier, risks are identified earlier, and people are essentially supported throughout the realities of what's going on in their life. Now, I have one more testimonial, and this is it. No soundbite, no video. It's just this picture and a quote on the screen. But this is an example of an organization that they implemented a mobile mammography program. But this is an organization that had a more male-dominated employee population. And after talking to employees, they actually realized that the females in the female employees weren't getting their preventive care, such as mammographies. And so they looked at what was going on and the barriers, again, understanding those barriers, the barrier of where they were located and having access to that care, and also really the barrier of taking time off from work. So when the organization looked at this, they said, okay, here's the female population. It's not our dominant, but they're not getting the preventive care. We'll bring it to them. And so they did this mobile mammography program at the office, the location. And there was one individual, female, who did her mammogram and actually, unfortunately, found out she did have breast cancer. So she went through all of the treatment. But at the end of the day, and this is just exactly what she said, you saved my life. So she was able to get the treatment. It was obviously she was a little bit more into having it than being preventive, but this is another example of where you can truly impact someone's life, no matter where they are on that spectrum.
Yeah, I think what just strikes me is the human impact of the work that we all are doing today, and it's very real. And so our conversation is around preventive care, but the impact that can have at a human level is really profound. So great real life examples there. We're going to pivot a lot, and we're going to get a little more tactical with our conversation. So Christine and I wanted to talk about three things: data, investment, and communications. So I'm going to kick off with data, which may not be surprising given that I'm coming from the Center for Research with WebMD. And, I want to start at the center. We follow a very specific mantra. It's something that we like to say quite a lot. You can't manage what you don't measure, right? Many of you have probably heard that. Many of you have probably said that. Maybe some of you already use that as your little mantra tagline. We certainly didn't coin it, but it is one that we believe in very deeply. And before building out any strategy, you need to know what you're trying to accomplish. What are your hurdles? Where are the barriers? And so the point here with data is that it is one of the most important aspects of your strategy. So take an inventory of what's available to you, and there's probably many different sources that you could leverage. Medical and pharmacy claims. It could be health assessment data, biometric screenings. I know we saw in the chat that many of you are paying attention to what's coming through your claims. You're implementing biometric screenings. Those are incredibly rich sources of data that can tell you a lot about where the needs are within your population. But don't ignore safety or disability, or even your broader employee surveys, even the water cooler conversations that maybe are happening a little less now than what they were 10 years ago, just given the current workplace dynamics. But the idea is that you're collecting information from any number of different sources, whether that be hard numbers or whether that be word of mouth. It is all valuable. So looking across all of these different sources is really the only way to truly understand what needs are out there and to help you spot the greatest opportunities. Ask yourself these questions. What are we learning about? What do we know about what's driving costs within our organization? What do we understand to be the gaps, whether that be gaps in care, gaps in access? What are we hearing from employees specifically about their barriers to using preventive care services? Also, what populations are you seeing that may need extra support or maybe more targeted interventions? And once you have answers to these questions, you can stop guessing and you can start executing with more precision. And so we'll use an example here. Based off of data from WebMD's book of business, we know that men are nearly twice as likely to be out of compliance with their recommended preventive exams relative to their female counterparts. Now, when we look across industry, we see that relationship holds up, but there becomes a lot more variability in terms of the compliance gap between men and women. We see differences in compliance by job type, hourly salary. We see differences in a number of different demographic characteristics. And so having visibility into some of these specific nuanced relationships is what will allow you to really effectively channel your efforts and allocate your budget well. This is exactly what we do for our clients, how we support. We do the slicing and dicing of the data. We help to uncover these hidden opportunities so that we can help create and design programs and interventions to meet people where they are. All right, so data, clearly very important. I guess the other point that I want to make on the investment side is that prevention will require a shift in how we think about our investment or our budget. When you launch an effective prevention strategy, your short-term utilization and your cost are very likely to go up. But here's the critical mindset shift that we need to take, and what we need to make sure our leadership understands is that this is actually a good thing. This is a good thing. I see Christine smiling. It's not about efficiency. That's not what this is telling us. This is an indicator of success. I mean, we're doing good. We're doing a good thing. We're doing good work. It means our people are actually getting appropriate and early care. And what you see on this slide here are all different examples of where that investment might happen. It might be biometric screenings. It may be that you're promoting health coaching, or there's different lifestyle programs that could be implemented. But think about it as an upstream investment. By identifying health risks early, we are actively mitigating the potential for higher cost claims, for complex complications, and also lost productivity down the road. Ultimately, organizations who prioritize prevention as part of their broader well-being strategy aren't just managing a healthcare spend, but they're also building a far more resilient workforce into the future.
Okay, so the third one is my favorite. And because Erin just said, like, well, you have to prioritize preventive care. Okay, well, how do we do that? And being the person in marketing, I mean, communications is pretty important. And I see that some of you mentioned communications in the chat as well. I think one of the biggest mistakes that we can make is assuming that offering preventive care is enough. But we all know just because we offer benefits, it doesn't create outcomes. We need people to take action. And so awareness means communication. We need to motivate people. We need to create easy access. Those are the things that are going to get people to take action. So on your screen, I created a very simple way to remember this, which is awareness plus motivation plus easy access equals action. I tried to think of like a word that we could create from this, but I wasn't creative enough. So you have to be strategic in what you communicate. And the important thing is that communication has to include a lot of information, but it also has to be simple. So what do you want your employees to do related to preventive care? How do you want them to do it? You also need to incorporate in that communication, you have to recognize the barriers. Is it cost? Is it time? And you have to address those in your communications. So for example, my employees are worried about cost. So I'm going to say, if this is true, many preventive services are covered at 100%. And it only takes 15 minutes to get your biometric screening. We cover time. And then something about the value or the benefit. Why should your employees care? So you kind of need to think about, okay, if you act now and you do this, we're going to hopefully address some health issues later. So the other thing that you have to consider in part of your communications is if you offer an incentive for the preventive care, the screening, tell them that as well. It's a nice little nugget to get people to take action. And I think the biggest thing that we forget about is that you need to communicate and communicate often. Preventive care communications shouldn't happen once a year during open enrollment or whenever you do it at the start of the new year. It should be an ongoing conversation that really does meet people where they are throughout the year. So, which brings me to this next question. Oh, good, it spells AIM or AIM. Appreciate that, Erin. Thank you.
I thought that was too clever to let go.
Someone else that said that. I didn't know it was you. But okay, so I have another question for all of you. We know incentives can be effective in driving utilization for preventive care. So let us know, again, use the chat. Are you using incentives to encourage or promote preventive care engagement? So yes, no, emoji, whatever you want to do, let us know. And I think I saw some previously as well. Some of you are using incentives. So I'll let you, all carrots, no sticks here. I love that. Yes. Okay. I will share, and if you all want to include, maybe if you want to share some details, cash rewards, medical deduction, discount, those are great things. Share for others, because sometimes that's helpful to get an understanding of what people are doing. I can share that probably about half of our book of business, and that's employers and health plans combined, offer some form of reward tied specifically to preventive care. And that can span getting an annual wellness exam. Others are using it for kind of the upfront assessment. So whether it's the HA or biometric screenings. And we've certainly seen, I would say, a little bit more of an increase over the last few years of organizations integrating preventive care into their reward strategy. What I will say is the how looks different depending on the organization's goals, their priorities, their budget. But it is clear that prevention is important across our book of business, and incentives is another way to do that. So great. I love that you all are sharing. FSA and HSA contributions are another great example. And yes, medical premium discounts. So like we said, it looks different for everybody, but there's many good options, of course, in the chat. I want to illustrate the importance of communications and our, I guess, what Erin's calling our AIM strategy: awareness, motivation, easy access to get action approach. And in this example, I'm using Men's Health. Now, first and foremost, June is Men's Health Month. So this, by the way, is a great example, not just doing it once a year, but promoting preventive health and targeting a specific population. So men's health. We also know that the male population is a little bit more difficult to engage in preventive care. They're less likely to schedule their exam or establish, a PCP. Yes, I scheduled my husband's appointment because I was like, you need this. So sometimes we have to do it for them. But the goal isn't just to provide information in the communications. It's really, as we said, to move people from awareness to action. So if you look at the screen, to the far left is a how-to guide, how to motivate men to get the care that they need. So this is a guide for you as the employer or the health plan. Help me understand how I can best reach this population and what are the elements I should include. You will get a copy of this particular piece after the webinar in some of our outreach post-webinar. The other two examples are communications that we provide when we work with our clients. So you can notice the message obviously is tailored to men, and there's two different types of messages. I mean, we can be pretty like, how do we capture their attention? Check in, man. And then just providing simple, relevant, action-oriented information that removes the barriers. Obviously, you want to customize the communication to your population, either what you're incenting on, what's covered at 100%. But the whole goal here is to communicate what action you want them to take, why it matters, and how they can do this. Now, sometimes the most effective communication strategies may not be the most sophisticated. Or as one of our clients said, you have to be open to old, new ideas. So this is one client that found, despite multiple digital communications, engagement was just remaining low. And it was particularly for the spouses. And this was a segment that, one, was hard for them to reach, but two, they really wanted to reach the spouse population. So they took a different approach. We encouraged them to do what is kind of old school, but create a postcard and mail it to the home. And they were like, what? But they did it. And spouses and family members saw the postcard, and you can see they saw an increase in spouse engagement as part of that postcard campaign. So it can be surprising. You might have to test different things. And again, as we've been saying, think about the population you are trying to reach and ways that you can engage those individuals. And actually, I see someone saying, engaging dependents. And, that's important when you also look at who's driving the costs in your population. Sometimes it is the dependents. We were talking, maybe it was a couple of days ago, about mental health as a high cost driver. And it actually winds up being sometimes the dependents that are driving the mental health costs. So just different, you have to look at your data for sure. One of the other barriers to preventive care isn't necessarily awareness of the importance of preventive care. It's simply, as we all know, that employees are just busy. And so to improve engagement, you want to think about how your wellness program can be integrated into employees' everyday workflow, what they're doing every day, because we know that visibility drives action. So make preventive care campaigns or rewards progress or any of your wellness resources accessible through tools that your employees are already using. That just makes participation become more likely. So things like maybe you have a corporate social platform, you use different types of chat platforms, like we use Ring Central, and you can create different teams, or if you have Microsoft Teams, use what you already have your employees using to promote preventive care programs and reminders like, hey, don't forget to take the health assessment, or biometric screenings are in the office this week, or whatever it is that you want them to do. And don't forget to include the why, the value, because that's another prompter for them to engage. I think the easier it is for employees to to see it, to access it, and act on those preventive care opportunities during the workday, the more likely you are to engage and help your employees stay on track with their health. Sounds simple, but it actually does work. And so I think what we're trying to say when you think about communications, outreach, it's not one way, it's all the ways. And so I'm not going to go through this list, but think about the personas we talked about, those real employees. How do we push out health goals and preventive care reminders within our platform? You need those proactive touch points, whether it's nudges or check-ins or prompts that support, people before issues escalate. I would also say, believe it or not, it also means normalizing the preventive care conversation within your organization, within your culture, through leadership, through peer-led initiatives, visible role modeling, all of those things that it makes engaging with the health support not feel like a barrier in itself. It's accepted as part of your culture.
Yeah, I think, Christine, we talk about cultural well-being as being one of the most influential aspects of a successful initiative or successful strategy. And I think that is very much so true here. Role modeling, leadership engagement, having it normalized so that leaving an office for a 30-minute appointment is okay. And that's not easy change to happen, but when it's there, when it's prevalent, it's wildly impactful. Okay, so we're going to take a breath. We've covered a lot so far. We've touched on the importance of prevention, talked a little bit about the value to employees and to employers. We went tactical. We presented 3 key areas for you to think about as you're looking to rework or design your strategy. And now we wanted to pivot to highlight a few success stories of clients that we've worked with in the past, employers who've approached prevention through that broader well-being strategy. Now, I want to start by saying that we understand, we get that well-being initiatives are fundamentally driven by 2 core objectives: reducing risk and managing cost. This has been true for many years. The goalposts have not changed. And if anything, this dual mandate of sorts has become more important in today's climate. However, achieving these goals is not easy. There's no singular path to success. If anything, we know that it requires commitment to doing the hard work. And this is exactly what I wanted to share, our 2 organizations who are doing this really hard work. So our first case example is an organization that was really focused on driving preventive care engagement. They had observed an uptick in preventable illness. They were seeing diagnoses happen later, much more complex conditions. And when they were looking at their claims, they were seeing costs a lot higher than what they had been. It was very apparent to them when looking across their many data sources that employees were not going in for their preventive care visits. And what they heard from their people was that they had fallen out of their routine. There was a lot of disruption that happened back in 2020 with the pandemic. Healthcare became harder to access. Employees had a number of competing priorities, you name it, they heard it. But what was very clear to them is that doing nothing was not an option. And so they put forward a strategy really grounded in well-being, focused on driving awareness and advocacy. They created a strong network internal to their organization to build that grassroots support and engagement. And then they leveraged incentives. Again, a strategy that many of you are also using, but they tied their rewards directly to health assessment, both questionnaire and biometric screenings. They tied it also to preventive care visits and services, but prioritizing this early health assessment really helped individuals to understand what their risks were, to learn about what benefits were available to them, resources and different program opportunities. And as you look at the chart on the left, the most important thing here is not so much the numbers, but it's what the numbers represent. Year over year, more employees earned their full reward, which really demonstrated to them that the clear strategy with a simple message, consistent communication, meaningful incentive can really drive that lasting engagement. And this participation yielded meaningful impact by connecting people to preventive services. Individuals who participated in the program, those who earned the full reward, experienced a 20% improvement in preventive exam compliance compared to non-participants who were going the wrong direction. So this was a very important demonstration of success that they were able to bring to their leadership. Now, our second client highlight, if you will, example, I think is very much so reflective of more the marathon aspect of well-being. This is a 15-year partnership with an organization, very challenging industry, largely deskless, dispersed workforce, many of whom work in very high-risk environments. Clearly having to navigate a number of logistical hurdles, but the organization remained very diligent, focused on their core objectives, which really were aligned to that dual mandate that I mentioned earlier about risk reduction and managing costs. And they did all the right things. They implemented best practices. They took a holistic approach to addressing the needs that exist across the health continuum, secured leadership buy-in, built grassroots support, and early on, they sought to make access to preventive care easier by bringing in on-site clinics. And that's one way to help reduce friction, to improve utilization. But because they treated well-being as a broader part of their core business strategy, they've been able to achieve really outstanding results. And you can see that reflected here, both in terms of improvements in health and overall healthcare costs. It's just a stellar example of how a smart investment can really move the needle. So, as we look to wrap up our time together, there really are three core takeaways that we would like for you to bring back to your teams. We touched on them earlier. We'll do a quick recap here. First, let data be your compass. It is a really positive roadmap for you so you can build your strategy around what the needs are that exist within your population. Second, remind leadership that prevention does require that upfront investment. The payoff now is perhaps more in how people are showing up at work every single day. And finally, again, this is Christine's favorite, communicate early, communicate often, communicate simply. Your people cannot act if they aren't aware or if they don't understand what the expectations are. So our hope today is that you can walk away with at least one practical idea that you can put into motion sooner than later. It doesn't have to be a full overhaul of your strategy overnight to make an impact. So as we think about the immediate future and some of those quick steps that you might take, I'd love for everyone to, again, open up the chat and share what is one preventive care behavior or strategy that your organization could make easier in the next 90 days. Again, you can see the question here, but what's that one behavior, that one strategy that you think could maybe be changed a little bit to be a little better for your employees?
Now, I would focus on communications, just saying.
You don't say. I saw that reflected in many of the comments already. Communication is often a challenge, but it is a very, very important aspect of a strategy. I would say segmentation, going back to the data and doing the cutting so that you can really get some specificity around your design and strategy. On-site screenings, I'm seeing communications mentioned multiple times.
So there's a lot happening, and we appreciate you all participating in this for sure. As Erin was talking, I know there was a ton of questions coming in, so I was trying to answer some of them, because we truly believe that we should not go to the top of the hour, because everyone needs quick moment for brain reset and whatever else you might want to do. So I'm going to end with just saying that well-being is prevention and prevention is well-being. And we believe that prevention is most effective when it's not treated as a standalone initiative, but as part of your broader well-being strategy. And as we've talked about in this quick hour, the opportunity is to be proactive, recognizing the factors that influence health behaviors with your employees in your organization, address risks earlier, and create an environment where people can take action before issues become more complex and costly. And so by integrating prevention into a whole person well-being approach, we believe that you can support a healthier workforce, improve your employee experience, and help manage long-term impact of rising healthcare costs. Now, before we jump off the call today, we're not going to get to the questions, but the one thing I do want to say is Erin is going to be speaking in another webinar next Tuesday, June 30th. You can see that on your dashboard, and there's a link to register. This webinar is our Center for Research 2026 Workplace and Wellbeing Employee Survey results. So you want to incorporate preventive care in your strategy, but what else should you be looking at? Sign up for that webinar next Tuesday, because she's going to reveal a lot of those insights from that survey. On behalf of WebMD Health Services, I want to thank you all for joining today, participating, being super active in our chat. Hopefully we gave you some great ideas, and we'll see you next time. Thank you, everyone. Have a great rest of your week.
Thank you.